country. Can the state really afford to take full responsibility to ensure that everyone gets the vaccine? Joining us is Director of the Study in Poverty and Inequality Institute, Isabel Fryer, and the Founding Director at the Center for Economic Development and Transformation, Duma Gugule. Good evening to both of you, and thank you so much for your time. A commitment has been made by President Cyril Ramaphosa that all South Africans will be vaccinated as soon as possible. Big questions about where the money is going to come from. Isabel, your reflections.
Thanks, Kathy. I think that it is a million-dollar question. We know that there are competing demands on the fiscus. We've already been talking about the extension of social security grants, which are due to come to an end at the end of this month. And now the cost of the vaccine comes up as well. You made reference to the point of whether the fiscus is going to underwrite the full cost of the vaccine or whether private medical aids are going to come to the party as well. If you look at the statistics, generally about 18% of South Africans are covered by medical aid. So of course that does leave a very large hole of people who are to be covered. But the point is that we need to ask where the sources of national funding come from. We've had a very neoliberal approach to state financing, looking at reducing corporate taxation over the years, increasing, as we know, the VAT 2 years ago, which created a huge crisis for the poor. So the question is in a country as unequal as ours, where the bulk of the cost of such a national crisis should be covered from, is a very demanding question.
Duma, do we need to look at a model of cross-subsidizing here? Because the private sector has, of course, over decades now been partly funded by the government. Do you think it's time that they pay back effectively some of that money?
Kathy, I just have to mention one thing. As Isabel says, the majority of South Africans are not covered by medical aid. So I think most South Africans now agree that there isn't a financial constraint towards funding this vaccine. The direct cost of the acquisition will be about 10 billion rands, depending on which vaccine we take, and there will be additional distributional costs for the vaccine. The cost of the vaccine is a small percentage of the costs of the economic crisis caused by the lockdown, which is about 500 billion rand. So I think there is no recovery in our economy without getting this pandemic under control. And I think I have to say, there'll be inevitable delays in terms of rolling out this vaccination. But I think we cannot pin our hopes only on vaccination, and we can't just pin our hopes only on lockdowns, because lockdowns only delay the spread of infections. We have to start implementing other public health measures while we are rolling out the vaccine to bring this pandemic under control. We've seen so many case studies from other countries as to what works. For example, there's a lot of people are talking about universal testing. In the United Arab Emirates, they've tested 22 million people, which is more than double their population of 9.6 million people. And we've also seen in Southeast Asia, also in West Africa during Ebola, they use contact tracing to bring the pandemic under control. So once you have a number of infected people, so the key is what happens after people are infected. Because if you don't take control of what happens after people are infected, it can spiral out of control. You have something called a reproduction number, where one person, for example, could be infecting 2 people. So 1,000 infected people can be 2,000, 4,000, 8,000, and 16,000 very quickly. So I think that the government has not invested in contact tracing. And finally, we haven't employed public health workers. I believe that is a big omission in the present employment stimulus, not to include maybe 10, 50,000 public health workers, community health workers, to be involved in public education and also doing the contact tracing, the epidemiological detective work, where you track down the people who are infected and the contacts and the places where they were infected.
It seemed to have been something that the government paid attention to at the onset of the virus, but somehow fell by the wayside. When we hear all of these concerns around money and spending, Isabel, What is this effectively going to mean for the most vulnerable in our societies? Last week, the president spoke about how discussions about a basic income grant will continue, but certainly nothing about the way he said it inspired confidence that it would in fact be anything that was done.
You do throw out some very difficult questions, Kathy. But I think that we are all grappling with them, and that's why the address by the president this evening is so eagerly awaited. So we know that people are getting into deeper and deeper poverty, and more people are getting into deeper poverty. We know that unemployment is has been rising repeatedly quarter upon quarter, and that's going to continue. As Duma said, that if we continue to strengthen and have stricter lockdowns, that means more people with informal and vulnerable income lifelines are going to be affected. So the question is, in terms of public policy, does it have to be a binary? Do we have to vaccinate and therefore not give access to people money so that they can buy food? One of the issues that's come up for me again and again is the question of school feeding. So it's useful to know that on Wednesday at NEDLAC, we're going to be having a meeting with Treasury in terms of which each constituency comes and says, these are the priorities. And Treasury then is able to share with us the balance sheet and say, these are the pools in which we're going to draw down from. But our line is going to be consistently, we need to be looking at alternative and new sources of financing. We've run dry in terms of the traditional sources. So a number of economists, such as Duma, at the beginning of lockdown was saying we need to look at aspects such as quantitative easing. We know that we need to both sustain and stabilize the economy, but we need to stimulate. So how are we going to make sure that we address the health pandemic in terms of vaccination, while at the same time continue to get the economy to circulate so that people are not to put very crudely, are not saved to get into a further and more critical starvation crisis at the end of the day. It's an incredibly difficult dimension of policy calculations, but I think it's important that we look at it fearlessly and say, these are the trade-offs, this is what needs to happen. At the end of the day, we need to be guided by human rights, but we also need to be looking at how do we ensure that we can start putting out the feelers so that people are both maintained but are also able to come back into an economy that's ready to embrace them.
You make the point, Isabel, and I think it's an important one, that there are no easy answers in this situation. It needs a lot of reflection, and I suppose people who also know what they're doing. Duma, are there specific measures that you are going to be looking at and that you have been looking at that give you an indication that in fact this country's government knows what it is doing and that it is on top of things in terms of the direction that it has when it comes to steering this country through COVID-19 and hopefully being able to have some kind of economic recovery on the other side of it?
You know, Kathy, the president announced a soft lockdown, and then now he's expected to announce further restrictions. But the point is, you can't announce lockdown measures without announcing further income support to households, because as Isabel said, the grants are going to end at the end of end of January. We have to extend those grants. And as the president said in his January 8th statement, we have to accelerate this debate around a basic income grant. Most civil society organizations are talking about a basic income grant at the upper poverty level of 1,268 a month. And that would cost about 500 billion rands a year. And we have to think, there are many ways in which we can fund it. For example, as Isabel said, there's monetary financing by the Reserve Bank. Our debt at the end of this crisis will still not be high by international standards. And we've got surpluses in our social security funds. The UIF recently just finished paying 55 billion rands towards employment and people who had lost their jobs temporarily. There's still 100 billion rands in that pot of money. And the government employees pension fund is grossly overfunded. It has a surplus of about 55 billion rands a year. It has been accumulating these surpluses for a long time. It's about time that we look at all possible sources of funding this basic income grant. We also have excess foreign exchange reserves of about 800 billion. It's way in excess of the international benchmark of about 3 months of imports that you should keep as a rainy day kitty to finance your imports. South Africa has been running current account surpluses for most of this year, and we've been running trade surpluses for a number of years. So we don't have external financing constraints in terms of our balance of payments, and the exchange reserve excessive, we can dip into that. So there are many options that we can have. This is a once in a century pandemic. It is about time that we take extraordinary measures to be able to take our country, solve the public health crisis, and find us a stimulus for our people in South Africa.
All right. Now, Duma, I guess it's easier said than done. Isabel, do you have any confidence that there will be any radical steps, and I say the word with a bit of shudder really, taken to try and improve our economic situation?
I know that many people are looking at it around the clock, trying to see what we should do. I think that the problem that we have is that it takes courage to take those bold, as you said, possibly radical steps. Some of the thinking that has already been articulated in terms of redistribution of income. I mean, Kathy, at the heart of it is we need the economy to keep circulating. And if it comes to a shutdown, it's going to stop doing that. So what are the ways in which we can continue to do that? The ways of ensuring that informal traders are able to trade in a safe way is something which has been looked at. The kinds of public space management is important. In addition to that, how you go about trying to look at your priorities is just a critical exemplar of the society that you're hoping to build. We know that Treasury has already cut line departments' spending time and time again. We're in austerity, but we seem to have a deafening inability, that's the wrong use of English, sorry, but government seems unable to hear the encouragement that we need to stimulate. As Duma was saying, we need to be looking at new ways of financing for what is a crisis, or else come the end of it, we're going to be so far down the line in terms of development that we really will be moving away from the upper middle income country level. So there are ways of raising fiscal financing. So people have talked a lot about a wealth tax. And it seems that for the years that we've been talking about it, we could actually have done something a lot more positive in terms of trying to access some of the idle wealth that has been sitting around. So looking at the kinds of property tax, the wealth tax is important, estate duty tax, ways that don't affect the current used capital, the capital that's being used to manufacture, to produce, but we're not doing that. Instead, what we're hearing from Treasury and other officials is we can't hear, we need to be hearing how we can. And those are the questions, the debates that we need to be having. We put a few on the table in this interview, and we trust that by the time we listen to the President tonight, that a number of other people will have raised their voices, because we have to can, not can't.
All right, we're going to have to leave it there for tonight. Let me thank you both for your time, Isabel Fryer and Duma Gubule.